I'm Dr. Neil Chamberlain. I'm a urologist, been practicing for almost 50 years. Injured my back in '83, had a major disc problem. At that time was operated on, had a spinal fusion. I got infected, seriously ill for a long period of time with serious back problems. But I eventually recovered from that and did well until I came here to this farm. I do a lot of lifting and moving sacks of feed around. And in 2002, I again injured, began to have severe low back pain. Actually had a friend visiting from California who knew Dr. Bork. In fact, I knew Dr. Bork because he and I were in the same building in Long Beach, California for years. So he referred me down to Dr. Bork because of the pain that I was having, which at that time was quite debilitating. And he did, I walked in with a cane at that time, and he performed his surgery and actually was essentially pain-free. Following this, returned home and in 2 days, went back to work in a week. Similar circumstance in 2004, again injured another level of my back, lower back, and again the same sequence went down, and in one day and out that same day, drove back to Tennessee and was back to work again without pain in approximately a week. The last time I had a problem was a different problem. I actually had a severe disc disruption at L1, L2, and that was in April of 2009. Again, we drove down to Defuniak Springs. He saw me that morning, operated on me later on that day because he knew me very well by this time. He knew my back. And by that afternoon, I was out and active. In fact, my wife and I even went out to dinner the day of surgery with minimal discomfort. And again, drove back to work, drove back to Tennessee that next day, and again, was back to work with a short period of time. I've always had wonderful experiences with this. It's an amazing corrective procedure. I wouldn't recommend any other type of surgery other than this. I mean, I think that it's the only way to go now. So minimally invasive and with minimal anesthesia.